So Charlie Brogan would like to know more details about inter-hospital transfers, and Dr. Antone, I'm going to call you up to talk a little bit more detail about that.
Well, first of all, I didn't know about this $2 bump, so I'm going to ask the governor for this $2 bump now that I know about it. But yesterday, specifically St. Francis Hospital in Grand Island did transfer out 5 different patients, all specifically for medical reasons that needed care at either University of Nebraska Medical Center or Bergen Mercy Medical Center or at other hospitals that could provide care to those patients. So there were a number of 5 transferred yesterday, 2 the day before. And again, the beauty of that system is that it's all within the Catholic Healthcare Initiative, the CHI system. But again, we have the cooperation of every hospital in the state to do inter-hospital transfers if that's necessary. So definitely it's been done. We've obviously transferred patients from some skilled nursing facilities, assisted living facilities into the hospital system. The coordination has been great. We've got good transportation issues set up. So far it's worked just as we've planned it, and hopefully it'll go forward like that. The governor mentioned, as far as Grand Island being sort of the hotspot right now, I'm in communication with the CMO of that hospital, at least on a daily basis, sometimes twice daily basis. And even though they are working extremely hard, they still feel that things are under control in their facility. So we have great bed capacity throughout the state. 50% of the beds in the state now are unoccupied and ready to be occupied at any time. Similar for ICU beds. So far we haven't overwhelmed the healthcare system whatsoever. I think it was my daughter that sent me this, I think it was a YouTube video, and I wanted to mention it. Has anybody seen the one with the mouse traps and the ping pong balls? And how when they put that together, when they're side by side, and they put 100 together, and they throw a ping pong ball on top, every one of them goes off within like a few seconds. But if you space them apart like 6 inches, not one of them goes off. And that's exactly what we're doing. That's what the purpose of this distancing and non-pharmaceutical interventions are, is to prevent that, rather than 100 going off, so that 10% of that 100 are going to utilize the hospital systems, that we don't do that. And so far, that's been what's been taking place. So I know that was a long answer to that question, but I didn't know if I'd get a chance again to say that.
Yeah,
Watch that video.
and yeah, Dr. Antone, I know you're always a microphone hog when you get up here. I get it. But again, I think but your point about the ping pong ball is exactly right, and it actually kind of goes back to what we were talking about with the questions about herd immunity or whatever. The whole point is to make sure that we spread this out, and we have been doing that, to make sure we flatten the curve so that we don't overwhelm the healthcare system, and it is working.